Hey everyone, welcome! In this explainer, we're going to demystify some of the most common antibiotics out there. Our goal is to help you understand those confusing names and learn what they're actually for, so you can be a more informed patient.
Yeah, have you ever wondered about that? It's a really good question. The simple answer is that different bacterial infections are kind of like different repair jobs, and antibiotics, they're a highly specialized toolkit. You wouldn't use a hammer to fix a leaky pipe, right? Well, in the same way, doctors need the exact right tool for the right infection. Today, we're going to take a look inside that medical toolkit. Okay, before we dive into any of the actual drug names, we have to cover the most important rule of all. Seriously, this is the foundation for everything else we're about to discuss. This right here, this is the golden rule, and it's non-negotiable. We're here to help you understand things better so you can have smarter conversations with your doctor. This is absolutely not a guide for you to diagnose or treat yourself. The bottom line is, always trust a healthcare professional. You know, when a doctor picks an antibiotic, it's an incredibly complex decision. They aren't just picking a name off a list. They're thinking about your medical history, any allergies you have, and even data about which bacteria in your local area have become resistant to certain drugs. And super important to remember, antibiotics do absolutely nothing for viruses like the common cold or the flu. All right, let's get into our first group of antibiotics. You can think of these as the reliable first-line tools in a doctor's bag, the ones they reach for to handle a whole wide range of common bacterial infections. So you've probably seen some of these names before, right? Amoxicillin, that's a classic go-to for lots of general bacterial problems. A lot of these, like the penicillins, work by basically attacking the bacteria's cell wall until it just falls apart. Now, when doctors need a bit more power, they might go for amoxicillin with clavulinate. That little extra ingredient helps it fight off tougher bacteria, like the kind you'd find in a sinus infection or an animal bite. Then you've got penicillin V for things like strep throat, and cephalexin, which is often a first choice for skin infections. Okay, so we've talked about the generalists. Now let's get into the specialists. These are the antibiotics that get chosen when the doctor has a really good idea of exactly where the infection is and what kind of bacteria is probably causing it. They're way more targeted. So this next group, they really zero in on specific parts of the body. Azithromycin and levofloxacin, for example, are often used for respiratory infections. Instead of just hammering the cell wall, these often work by getting inside the bacteria and stopping them from making the proteins they need to survive and multiply. Doxycycline is pretty interesting because it's used for respiratory issues, but also for long-term acne treatment. And then there's clindamycin, a real specialist for skin and soft tissue infections. Now, let's look at another specialty area, urinary tract infections, or UTIs. Just look at how many different options there are for this one type of problem. You have a few that are highly specific, like nitrofurantoin and phosphomycin, and then others, like ciprofloxacin, that might be used in more select cases. So you're probably thinking, why so many choices for the same problem? Well, this goes right back to what we talked about in our rulebook. A doctor will choose the right specialist for the job based on your health history and, this is crucial, local resistance patterns. That just means they know which drugs the bacteria in your specific area are still vulnerable to. All right, time to level up. If that last group were specialists, then think of these guys as the special forces of the antibiotic world. These are powerful, often given through an IV, and they're reserved for serious, complex, or even life-threatening infections, almost always in a hospital. You can just see it in the language here, right? Severe, serious, hospital use. Ceftriaxone is a powerful tool for really bad infections, like severe pneumonia. Vancomycin targets something called gram-positive infections. Don't worry about the term, it's just a scientific way of classifying bacteria based on their cell wall. Think of it like a specific type of armor that this particular drug is designed to break right through. These are definitely not your everyday prescriptions. Wow, okay, this slide really puts the difference in scale into perspective. On one side, you have amoxicillin, our everyday workhorse for common infections. On the other side, you have something like piperacillin/tazobactam, which is basically a tank. It's used for really tough hospital-acquired infections and gives what's called broad coverage, meaning it's a massive weapon designed to fight a huge spectrum of dangerous bacteria all at once. Okay, let's shift gears for our final section. And honestly, this might be the most important part of our whole chat today. Knowledge isn't just about understanding the drugs. It's also about knowing when an infection, or maybe a reaction to a drug, is becoming a real emergency. Listen, these are absolutely not wait-and-see symptoms. If you're having trouble breathing or you faint, that requires immediate attention. Swelling around your face and lips, or a sudden widespread rash, that could be a severe allergic reaction. And a high fever combined with confusion or a stiff neck can be a sign of a very, very serious infection. If you or someone you know has any of these, you need to seek urgent medical care. So at the end of the day, what's the big takeaway? It's that understanding these tools helps you understand the bigger strategy. Knowing the difference between something like amoxicillin and vancomycin helps you appreciate just how complex treating an infection really is. And that knowledge empowers you to be an active, informed partner in your own health. And that's really where we want to leave you. Instead of just nodding and taking a prescription, maybe now you'll feel ready to ask something like, so is this a broad spectrum or a more targeted antibiotic? Or maybe, is this choice based on what we know about resistance in our area? Just thinking about that, that's the first step to becoming a more empowered patient. Thanks so much for joining us.